So it may be slightly different location.
Yeah.
But we have to do a new laminectomy.
For the back.
Yeah. So the problem is that first of all it will be 2 surgeries. Then there are some more complications because if you have 2 laminectomies in your spine, it can increase the risk of scoliosis.
Scoliosis.
Spinal, but the risk is less than 5%.
Yeah.
You know?
Yeah, it's like that on the back.
Because it can actually it can destabilize your spine because you will have to you know.
But I have already a small one.
Yeah.
It's a bit like that.
But it will be but the risk will be very, very low.
Okay.
Because the laminectomy is not big laminectomy, small laminectomy.
Yeah, because after it's less stable.
Yeah, it's less stable. And also, of course, 2 different surgeries, the more risk of infection and the wound complications, you know. So those are the possible complications.
Okay.
But it's possible to do both surgeries at the same time.
Yeah, maybe it's better because you have one narcose and.
Well, I think it's financially, of course, you know.
Yeah. Because for me, I really want to be better because I train so much.
I know.
And I would like to have a new function to train differently my body.
If you get both surgeries at the same time, then I'm very, very hopeful it will be good improvements in your both hand function and the legs. Because I'm very confident you will have good improvements in your leg function. But the problem, as I said, the patients who are paraplegic, they have good hand function, so they can do a lot of training. You know, they can use their upper limb to sport. So as long as you get back some functions in your upper limb, it will also ultimately help with your lower limb after the epidural stimulation.
Yeah. Or what about making first upper part and then 2 years or 3 down?
That's also possible.
Because I'm afraid you said there might be complications if he has such a big surgery.
I would say the most common complication.
You never had a patient that had at the same time?
Well, we don't have a patient who had at the same time, but of course we are ready. It's from surgical point of view, it's very easy to perform 2 surgeries at the same time.
But then, I mean, his body is going to have the strength to recover and to have no infection.
Well, we are not concerned about infection. I mean, it's possible, but the risk is very low. So he will be on antibiotics for both surgeries anyway. The only thing I'm concerned is scoliosis, but the risk is.
Because he already has a bit.
Yeah, but with this surgery, 2 surgeries, the risk will be less than 5%.
Yeah, okay.
You know? It's very low risk.
But now my question is, how much patient you make a surgery, and what's the result for example?
The 2 of them together has never been done.
No, but
the 2 together, no. But we have done 2 individual surgeries, right? We have treated many patients with the
spinal stem cell.
The stem cell.
But where come from the stem cells? Or where come from the stem cell?
They come from umbilical cord. The mesenchymal stem cells.
The stem cells from umbilical cord.
In the email that I sent you have like the information and stuff, and it says like they come from.
When someone, the newborn.
But the people in Thailand, it's a girl of Thailand, or?
Yeah, the people from Thailand.
Okay, it gives a cord umbilical, and you take a stem cell of her.
Yes.
Okay. And how many millions you take?
Well, it depends. If you get the surgeries for spinal cord injection, we will do 150 million. If you do epidural stimulation and the standard stem cell treatment, which is IV injection and the lumbar puncture injection, then 100 million stem cells.
100 millions. Okay.
Yeah. So it depends on the final treatment.
Because me, I received some stem cell in Ukraine, maybe 7 years ago.
From bone marrow.
But he injected me in the back.
Yeah.
So it was. I feel a little bit better, but it was not so much.
So where did the stem cells come from?
Yeah, like you with a
umbilical cord.
Yeah.
And where did they inject? Into your back?
Yeah, directly in my back with an injection.
So.
2 times.
But if with the local spinal cord injection, of course, the improvements are much better. Because
directly in the surgery. I think it's more logic.
Of course, yeah.
Because the stem cell can improve and helps to.
Because if you inject into your back, only 20% stem cells go towards your brain and the spinal cord.
Okay.
But if you inject a high number of stem cells right inside the spinal cord, then of course 100% stem cells go there. So the improvements are much better. Actually, we treated 5 patients with the T12 spinal cord injury,
Yeah.
And all of them, they were able to walk again with the sport.
With
That's-
10 patients, you have one to walk.
5 patients
5.
with spinal cord injection,
all of them.
like paraplegic, T12 spinal cord injury.
Yeah, but you have only one to walk.
Sorry?
For 5 patients, you have only one to walk again.
All of them.
All of them. But without electricity.
Yes, just the stem cell injection. But that those patients, they had T12.
Yeah.
Because it's difficult to regenerate the cervical spinal cord. It's more sophisticated, it's more complicated nerve connections in the spinal cord here. So
It's more
literally-
complicated. It's more complicated
It's more complicated.
in the neck to the back.
Yeah, because this spinal cord has to supply to the hands, so there are like many complicated movements, So it's very
Small.
It's difficult to basically recover the cervical spinal cord as compared to.
Yeah, more function in the neck
Exactly.
with the fingers.
Yeah, so it's
with
like
the
all
muscle.
the like respiratory function and
Okay. But in the totality, how many years you start with that?
Since when did you start to work with these patients?
for him.
No, for
Oh,
every patient.
many years ago, 2010.
2010.
We
Okay.
treated actually few hundred patients with spinal cord injury. Most of them with spinal cord, like stem cell injection. Many, like 25 patients with the electricity,
Yeah.
and 6 patients with the spinal cord local injection.
Okay. And this is new to use electricity. It's
Well, it's actually, if you look at the total number of patients in the whole world, there are only about 40 patients who got the electricity. So we treated 26 patients, so we have around 60% of the patients in the whole world.
I don't understand. Il a opéré 40 patients avec les stimulateurs au total.
40 patients in the
40,
whole
yeah,
world.
In the
40,
world?
Dans tout le monde. Pas lui,
And
mais
26
tout le monde.
he.
Ok.
So we treated 25 patients here.
Ok. Et puis sur les 40 ou 26, vous avez un feedback par rapport à ça?
Well, the feedback.
Yeah,
So
exactly.
yeah, I mean, of course, with epidural stimulation, patients who have good hand function, they are able to take steps. They are able to walk with the sport.
Yeah.
Most of them.
But my first question it's that because if you don't train, of course you get worse. But if you train, you don't know what's the possibility to recovery. So I'm sure you have some patient to never train and to do nothing, and he makes the surgery, and after, of course, he train and he improves the body, so
Well,
he get better. It's difficult to know exactly what is better. It's electricity or it's just training. This is
Usually, when a patient comes here and they do all this operation and they come over to Bangkok to get the treatment, they usually keep on training also. Once they do this first step, it's
Yeah.
normal for the patient.
Yeah, but I speak before the
of course,
surgery.
If some patients we see after 2 years of injury, only 2 years, they lose a lot of muscles, so it's very difficult to recover. Some patients even 20 years after the injury, they train maybe like yourself, train a lot,
Yeah.
so they have a much better chance of recovery. So your muscles are very important, So if your muscles are active, it's easy to recover. Your
Yeah.
muscles are dead, so it's very
So they
difficult.
say it's the other way around, as you think. The people that are training have
Yeah.
much better chances to
Of
recover.
course, yeah. And even after the treatment, you have to train very, very hard.
Yeah,
That sounds
yeah.
very
For me, it's not a problem to train, but
You have to train like 6 hours every day for at least 6 months.
yeah.
So that's
Okay. So it's interesting because me, I really want to know what is the best, and
well.
of course, it's about the money because it's 92,000 francs, so I need to fund some donation and to fund some money, and then if I make this surgery, I really would like to be sure I progress.
Well, yes, of course, it's a lot of money. So I think if you, it really depends upon your expectations. Really, if you think your hand function is the most important part, you want to really improve, then I would say we can do this spinal cord injection. But if you think you're happy with your hand function, and this is something you can maybe consider in the future, but you want to really stand up and take steps, maybe try to walk.
But what's the
then-
price? It's 40 40,000 euro.
No, it's around 40,000 euros, right? 52,000.
52,000 for the operation here. For this one here, it's like 92,000 with the
And
panels.
altogether, it's just
With
And
the
both?
stem cell, yes. The standard stem
And both are the price?
For both, actually, we calculated before. I think it will be around 110 to 115,000 because epidural stimulation is 92. Then we have to add extra stem cell and extra surgery cost and extra, treatments, extra rehab. So it will be 110 to maybe $115,000.
this includes the training that he has to do. He has to stay here for 6
For
months.
for epidural stimulation, it will be 35 days. For only this spinal cord injection is 24 days.
Yeah. And for example, if I make only the surgery and I stay 1 or 2 weeks and after I come back to train at home because I have my home coach and I train for 12 years, it's possible to do.
It will not make a big difference in terms of money.
Okay.
Because the most expensive part will be the stem cells and the surgery and first 10 days of the hospital stay because then you will be admitted to the hospital. So for extra 2 weeks, it is just outpatient because you have to stay on the outpatient room. You will not be admitted to the hospital. It's just a rehab. So it will not, you will not save too much
Okay.
money. Really.
Yeah. Okay.
Yeah, but up to you if you.
Yeah. Okay. But now what's happening with the maps, with the mapping? Because in Switzerland you have some. Do you know maybe Grégoire Courtine? No, it's Grégoire Courtine. He works for the research and he make with epicondyral therapy, but yeah, I see. But the movement it's not so smoothly. The movement of the legs it's not so because you put electricity in the legs and you try to do a right movement, and you have one legs to be straight, completely straight, or when you walk with electricity. We have some video of people
We have, this is called mapping, yes.
Yeah.
So you will do mapping here. So if you do epidural, you will stay here for around 5 to 6 weeks, like 35 days.
Yeah.
So we will do mapping.
Yeah. But can you explain me more in the detail which muscles work and exactly which contraction it
Well,
is?
we have to see after the surgery.
Because you don't know before.
Well, of course we do, you know.
Et ma question c'est de savoir si comment est le mouvement des jambes, sur quel muscle ça contracte, si la jambe elle est complètement tendue, par exemple la jambe droite, et après c'est l'autre qui plie, ou comment on sait exactement avec les courants, quel muscle vous utilisez.
Well, he wants to know with once he gets the mapping stuff, what muscles exactly will be the ones that are going to be used in the training.
Well, we will try to map all the muscles below your T12 level, you know.
Yeah.
So it will be abdominal muscles, your gluteus, your quadriceps, and your lower limb muscle. So we will try to map all the muscles, you know, because you have to use all of the muscles to properly take steps.
Yeah.
Yeah. So it will be all the muscles will be targeted.
Yeah. For using all the muscle when you walk.
Yeah. Actually, so this location in the spinal cord. So this is the part of the spinal cord which control the movements in the legs, you know. So basically the purpose is to stimulate this part of the spinal cord. So once you stimulate here, it will be all the muscles below your T12 level.
That was a question? Or?
Yeah. I think because the level T12 is the best level to find the best recovery and all muscles.
Exactly. So this is again, sorry. So this is called, so this is a network of nerves, and all those nerves, they actually supply to all the muscles below T12 level. So this part is the most important part for leg function.
Okay.
Yeah. For hand function is around C4, C5.
C4, C5, yeah. And how many quadriplegic do you have a surgery?
Epidural, 10 quadriplegics with epidural. The thing is that we got very good functions in the legs, but not good function in the hands.
Yeah. Because it's too down.
Yeah, it's too down, right?
Yeah.
It's just, you know, it's just
Yeah, it's
below
logic.
the level
Yeah.
of injury. Yeah.
but he was better with the legs and maybe to have
Yeah,
more
of course.
stability.
Yes. Like David, you see this patient.
Yeah.
He is able to take steps now when you put him in the hoist, so he's able to walk. But
Yeah.
his hands are, still a big problem.
But without electricity?
No, with electricity.
Yeah, it's only with electricity. But you think, or you are sure after 3 years, you can be better without
Well, I'm
electricity?
not
Because
sure. For
because
some-
the goal for me it's for sure to be better without electricity,
But-
to have new function. Because it's only with electricity, it's how you said, maybe you just put electricity in my nerves and he move. You understand what? Me, my goal it's really to get better, but
Well,
without electricity after.
well, I'm not sure if it is 2 years or 3 years, or could be 5 years, could be more.
Because you have
It
some
all
patient to train after 3 years after the surgery.
Some information.
Do you have some patient to have
Yeah,
to
I
train
mean,
after 3 or 4 years?
Well, the first patient here
Yeah.
got in 2015. So this patient can have a good sensory function. When the electricity is off, he has the sensory function and he has the blood control, but not enough to walk into last 2 years. But if we look at the original research, which is done in the USA, the first patient was treated in 2011, and in 2016 the patient got most of the functions without electricity. So
Okay.
it's 5 years for one patient, and so it could be, we don't know really, and we don't know because it's a long process. It also depends on your location, because your injury level is very high. So the thing is that this electricity will be here, then it travels through the spinal cord, right? So this, let's say your injury level is at T9 or T8, then it's easier for the electricity to stimulate the regeneration. But if it is very high, it means that only very little electricity will travel to your neck.
Yeah.
So it's slower than someone with the lower level of injury.
Okay.
But
And why you don't put electrode in the up and in the back?
well, if your injury level is at C3 or C2, then you can put at C5 level. Then you can have the hand function or the respiratory function. Your injury is at C4, so this part of the spinal cord is very damaged. So if you put the electrodes at neck, it will not work.
Yeah. But I already make that in the Ukraine too. He put electrode in my neck in C5, C6, and my fingers move
But
a little
it
bit.
was a different kind of electrode. It was needle electrode, 2 needles.
Yeah.
They stimulate the nerves which supply to your hands. This is different type of electricity.
Okay.
So that's temporary really. It's called subcutaneous to stimulate 2 single nerves per hands, right?
Yeah.
But this one you have to have a healthy spinal cord to put it properly, and then it can transmit the signals through the spinal cord. So for this stimulator to work, the injury level should be higher than this level.
Okay. And I have just a question about what's happened when, for example, I train with electricity and I decide to stop to train with electricity. Do you have some patient to take off, or you manage that after 2 or 3 years?
Well, we estimated it could be 2 to 3 years, but we don't know really. It could not be, of course, even after 2 to 3 years, the functions could not be as good as with the electricity. Because
Yeah.
for all the functions to perform without electricity, the spinal cord has to be regenerated. So it depends. For different patients, it takes different amount of time.
Yeah, but I ask, je demande en fait comment ça se passe si on met les électrodes et puis qu'après pour différentes raisons, 1 année ou 2 ans après, on décide de les enlever ou qu'il y a un problème. C'est parce que j'avais eu ce problème justement là où il m'a mis des électrodes au niveau du ventre pour la vessie, pour les jambes, et puis ils ont enlevé. Et c'est vrai que les fils avaient cassé, il y avait des adhérences.
Vous voulez savoir c'est que tout ça qui arrive en patient qui décide d'enlever les électrodes, c'est ça, non?
Voilà, après 2 ou 3 ans ou
Okay, he wants to know what happens to the patient that once they remove the electrodes from the body, like after 2 or 3 years, what would happen then?
It has never been done. All of them, they have the machine.
Okay, but all the patients use that now, for
Yeah,
example,
all of them they use now.
for example 3 or 5 or 6 years after.
yes, they still use it. No one ever has 100% recovery where we can remove the electrodes. Some
Okay.
functions come back, even the electricity is off.
So he like to use that.
You have
Patient
to,
like
but
to.
in my opinion, yes. And the thing is that you don't even feel it, right? It's very low intensity electricity. So it's just in your body. You don't even feel you are having electricity. It's not like the other electricity you received before.
Yeah. Okay. It's so low and
It's so low.
it just
Because,
help for the spinal cord.
because the other electricity you receive is far from the spinal cord, so they have to use very high intensity of electricity. This is actually a big chip right over the spinal cord into the epidural space, so you have to use very low intensity electricity. So most of the time they don't even feel it. It's just very low dose, so you can perform the functions, but it's not bother you. It will not make any trouble for you,
Okay.
and it's safe for the spinal cord. So I don't think it's realistic to expect like 100% recovery.
Yeah,
I
of
know,
course.
I know this is your goal, right?
No, it's not my goal, but to get
walk-
better. To
walk-
get better.
Yeah. Okay. So if your goal is to really, uh, like, not depending upon the electricity, I think it's little unrealistic, because again maybe you have to depend on this electricity for many years.
Yeah. Okay.
And it will not make any trouble. It can stay in your body. So this can stay in your body forever. This is like 9 to 11 years, because this is a battery here. So its life is 9 to 11 years. After 9 to 11 years, you may
And
have to.
where do you put this?
It's just in your abdominal wall on your backside here.
Yeah.
It's just under the skin.
Okay. Because before I have one ear, and when I do like that and like that, I have every time a little bit spasm and pain when I move, because I have one ear for the bladder and for the legs. I make that in Switzerland, but yeah,
This one will be.
I take out here.
Yeah. It's just very small.
Okay.
Most of the patients, they don't feel anything.
Okay.
Really. It's
Okay.
just,
And after 9 years, you have to.
Change.
Well, yes, you have to change the battery, but we don't know again how much is the battery, and because no patient got it 9 years ago. Really. But
Okay.
it should be simple surgery just to change the battery.
Okay. And you see some patient every year or every 2 years to do. Vous revoyez les patients toutes les années pour faire un contrôle, un check-up.
Ah, bien sûr, il y a beaucoup de personnes qui retournent ici pour faire deuxième traitement. Par
Ouais.
exemple, David, il habite à Hong Kong, mais il vient ici chaque 6 mois pour faire le training et tout ça.
Okay, because you don't train in Hong Kong.
He does.
But yeah, actually, many patients, they are very happy with the training here.
Yeah.
So
Yeah, I
come
see.
back.
Yeah.
Because maybe we are more professional in epidural, so
Yeah, you know what you do.
yeah.
But he said me he broke the legs because he worked too much. I don't understand.
Yeah, actually because he is again because of spinal cord injury, his bone density was very low.
Ah, okay.
And so I think he was being transferred from bed to wheelchair. Then maybe he broke his hip fracture.
But he broke on this hip or he broke some electrode too?
No, the hip.
Okay, no, you have no problem with the electricity?
No, of course, no problem. Just,
Okay.
He was still in the hospital, but it was not during the training or anything. I think
Yeah.
it happened at night when he was, maybe he went into the taxi somewhere.
Yeah.
He wasn't careful. So he just broke during the transfer.
Yeah, and after it's depend how you eat, how medicine you take, and
He also has very high body weight, and also his bone density was very low. His bones were very weak
yeah.
because never moved.
Yeah, this is the point.
But
If
you do a lot of training, right? So
Yeah.
your low body weight also. I mean, he's the first patient had a fracture.
Okay.
We treated patients with 23 years old injury. They are able to put all the body weight into legs, no fracture or anything.
Okay. But for example, we see me have a C4, C6 spinal cord injury.
C5, yeah, C5.
C5, okay. And because he feel better, or he feel better only with the legs? Because for me, I really want to be better, but not just for walking, but all the time in the life. For example, to make transfer,
Yeah.
to drive, and to be more fast.
But he only feels better with the legs.
You feel like a sensibility or
No, because he did not get stem cells. It was only the epidural stimulation.
with epidural it's more muscles,
It's more only the motor function.
motor function, okay,
No
not sensibility.
Yeah, but with stem cells is sensibility.
Ah, you think it's better for-
and bowel function.
Yeah.
Okay, yes.
You said with the stem cell it's better with a spinal cord and of course with bladder and stomach.
Bladder, bowel function, yeah.
And sensibility in the arm or in all the body?
Below the level of injury, in all the areas, the sensitivity.
All the body.
Yes, below the level of injury.
Okay. And with only you have how many patients do you have to do only stem cell therapy in the neck?
Only one patient in the neck.
Only one.
Yeah.
It's new.
It's well with the legs we treated 5, but with the neck only one patient.
Yeah.
Few weeks ago. It's too early to see, but he already have some. It was very severe injury.
It's the same injury or what is complete injury or?
Complete injury. No function at all.
Yeah.
He could only move his neck and little bit of shoulder.
Ah, so we have 3 or 3-4. 3. The spinal cord is 3 C3 or?
C4 to C6, but very severe.
Ah, yeah.
Yeah.
Because if you move only shoulder, it's
Only shoulders. It was well upper part of C4, and
now we can move the finger.
he can move hands and he can actually extend his elbow, and it's just 4 weeks after the surgery now.
Yeah. So it's good.
Yeah, so it's good enough. So after six months, I expect maybe his recovery will be same as you can do now.
Yeah.
Maybe better than you. But also he was on ventilation because of high injury level.
Yeah, with
And now he is able to
tracheotomy.
Yeah, he is able to sleep without any ventilation.
So for him it's
So good improvements in
good
that
step, yeah.
function. It's very good for him because before he was able, he needed mask and ventilation to sleep.
Okay, because I read with stem cells, you have a really different article about that. But the first point, it's because sometimes we don't know about how the body receives the stem cells, and maybe you can have a cancer or something like that because the body.
But with these stem cells, no.
Why?
Because these stem cells are, you can have cancer with embryonic stem cells.
Embryonic?
Embryo.
Yeah, but you take embryo.
No, this is not embryo. This is adult stem cells from umbilical cord.
Umbilical.
So these stem cells.
But it's not the same.
Huh?
No, it's not.
No.
Embryon.
Embryo is 10 days old. Embryo,
Embryon
like
is
very
like the
small.
baby.
Une fois que la femme a accouché l'enfant, on prend
Le cordon.
On va pas tuer l'enfant pour faire la cellule souche. L'embryo c'est autre chose, c'est comme ce petit enfant qui donne.
Ok, ouais.
Sinon, c'est pour
So
ça
la
qu'on.
première celle de le baby.
Yeah, exactly.
Ok.
We don't kill the baby. We don't kill the fetus.
Ok.
We just kill the motor cord. It's not the same. It's not
Okay.
the same.
So embryo is only 10 days old embryo. The umbilical cord is 9 months old umbilical cord. So it's different cells. Basically embryo is a very small mass of cells, and it is supposed to become the whole individual,
Yeah.
you know. So the potential is very high. So if we inject embryonic cells, and those cells keep getting the right signals in your body, they keep making new cells. So sometimes they can cause cancer. But these stem cells, after a few times making new cells, they will stop differentiating because they have different genes. They have different structure.
Okay.
So there is absolutely no risk of cancer with this stem cell treatment.
Okay. But why you start only now, a few weeks ago, to put stem cells in the neck for the spinal cord?
Well, so we had been doing the standard stem cell treatment, like the back injection for 10 years. So now, before it, we did not have a very good neurosurgeon who could do it because it's a neurosurgery. It's very delicate surgery to.
Yeah, because if you touch bad, you can be worse.
It can cause more damage to the spinal cord because of the needle. So we actually took our time to study and did our homework. And so about 4 months ago, we treated first patient with the T12 spinal cord injection. So we wanted to see the safety with the lower level injury first. Then we treated 5 patients with no problem. Then we treated our first patient with the neck also because it's more complicated to perform in the neck. Because if you have some complications, you may have some respiratory.
Yeah, I know. I have a tracheotomy, so I know.
Exactly. So there is also risk. I would say less than 1% risk that it may compress some of your nerves in your spinal cord, and those nerves supply to your chest muscles, you know. So there is a small risk if we perform this surgery, there is a small risk that you may have to need the ventilation for a few days. But this is temporary.
Yeah.
It's possible complication, but very low.
Yeah, because you have a compression and.
Yes. So there are some motor neurons which supply to your chest muscles. So because you have to inject stem cells, so the needle is very, very small. So there is no risk of damage because of the needle. It's very, very small. But there is a risk that the volume of the stem cells may compress the nerves, but it takes few days for the volume to be absorbed by the spinal cord. So after few days, it comes back to normal.
Okay. And you think it's a problem for me because I think I have already some cable here because you take off the cable in my arm here, but I think I have a little bit cable in the around the spinal cord because yes, 6 or 7 years ago he put me an electrode and cable.
That's no problem for
Because you can take when you open, you can take off and clean.
Well, I have to check with the. Sometimes there is
With
risk
your
of
ear.
more damage, you know. So if it is not causing any trouble, maybe we don't touch it. You know?
Yeah.
But this is something we can discuss with the neurosurgeon. We can check.
Okay, yeah. Because now I can take an ERM. You know, I can.
MRI, yeah.
MRI,
Yeah.
MRI, I can because I have cable, so I don't know if he used that. It's bad with, you know.
Is MRI compatible? Because you already did MRI.
Yeah, but I don't do that for maybe 3 or 4 years ago.
But did you do after the cable?
No, he said I
But you
can't.
have
I can, or you don't know because you don't know if you use a metal, it's bad and it can be hot.
Do you know the specific type material? You have to check with your surgeon.
No, I can't because when I was in Ukraine, I asked, but now you have the war, and yeah, I don't know where is the doctor and where is the hospital. You know,
So you don't-
nobody answers, so
Okay. Well,
it will be a little bit complicated
Where in Ukraine was that part?
because in Ukraine it's more
In which
free.
part?
Well, in Kiev, the capital of Kiev. It
No,
was,
I've been there.
really?
Yeah, in Odessa as well.
Where are you from?
Spain.
Oh, okay.
This is what we can check.
Okay.
You know, if it is you can find a way to check if it is MRI compatible or not.
Okay.
So if it is MRI, because if you put it like 4 years ago, if it is 20 years ago in a like developing country, then that's a different situation. Then before many years ago, they put iron and steel, you know. But these days, mostly is the MRI compatible material.
I think I can. I know I can't because when he take off the metal, he put in the garbage. But I thinking maybe we can.
It's when you do the surgery, then we can check.
Okay.
We can consider.
Okay.
If it is easy and no complication, of course. We can try to take it out.
Okay, so yeah, it's really interesting, everything. So of course I don't make the surgery in a few weeks ago because I need to find money.
Sure.
But maybe it's possible. But I'm really interesting to make maybe both. But it's possible to have the number of the address mail of the last customer you make the surgery 4 weeks ago about
The phone number?
or
Yeah,
just,
sure.
just a contact.
The Luis Garza.
Yeah, it was
Yeah, you
up
can
there.
put in contact. Yeah, sure.
Because it's really interesting to
It's
know
just,
how it progress. And
exactly.
Yes, sure.
Is too early, so I think we have to wait for at least 3 months to make to see really what kind of
Yeah,
improvements he got. But you definitely can speak.
But he put the electrostimulation too, or no?
No,
No,
only
just
the surgery.
Yeah,
in
okay.
the spine, yeah.
Because he's thinking it's too up, but maybe in the future I can make that.
Yeah, of course, right. You can do, of course, in the future you can do both at the same time. At first, you can do anyone really. You can do the epidural first for your legs, then you can do the surgery for neck, or you can do neck first and then.
Yeah, but me I prefer to make both if I can because
Yeah, of course.
I like to have one surgery and everything. My body is improving the best it can do.
Yeah. Then of course, then we can expect good improvements in both
Yeah.
hands and the legs.
And hands, by hands you mean the fingers?
Yeah, I mean this should be our focus.
Because hands he moves, but just
I know.
Just
it's,
like that.
Because it's just very difficult. It's very complicated nerve connections in your spine to perform the small movements. So, but we are hopeful to have enough improvements where he able to start feeding again and trying to do things on his own. Right?
He does. He
But
he
No,
eats
I
himself.
can't. I just do that.
yeah,
But you eat him yourself.
Yeah, but I do like
it's
that.
very difficult, right? So of course we hope to see improvements in there, like small movements also, like very very fine skills,
Yeah.
like
Yeah, yeah.
and maybe properly use.
Well, no, he grabs like that.
Yeah.
And you feel about the bladder and stomach, I can feel,
It's very much possible.
because now I can feel when the urine is coming,
Yeah.
but I can block. So I need to, I don't have so much time to go in the toilet,
Yeah.
But you think maybe I can block the bladder, and for the stomach I can.
Yeah, of course it's possible. Many patients they see very good improvements in bladder where they're able to.
But about not about spinal cord, not about stem cell. It's about electricity.
Well, for electricity, you have to wait for a few years to see good improvements in your bladder and bowel.
Okay.
Because
Because it's the same level a little bit.
sorry,
It's the same level with
the bladder is at this level.
yeah, and the epidural it's just a little bit up.
Yeah, it's up. It's not the target is not the bladder.
Okay.
The target is the this part of the spinal cord, which supplies to your legs. So if you want to target bladder, you have to implant it lower level, but then it will not work with your leg movements. So it's really
So it's why you said when you inject stem cells, you are fast,
faster, much faster the recovery. Because
better in the bladder and stomach.
yeah, because then the stem cells can regenerate the spinal cord, so they can improve bladder bowel function and sensitivity.
And you have better connection.
Better connection, and then this also helps better.
Yeah.
Works better the electricity.
But at this time, you don't know how much you can progress with the stem cell in the neck too, because maybe
Well,
after
I can
6 months
show-
he can fit the legs and maybe he can train like that.
Well, I can tell you for patients with lower level of injury,
Yeah.
patients, all of them they got very good improvements in their life.
Yeah, with electricity.
No, with stem cells.
Ah, with stem cells.
Yes. 5 patients. They
Yeah.
all of them able to walk with the sport. But as I said, the neck is a little bit more complicated, and we
Yeah,
had only one patient few weeks ago. So we have to wait for 3 months really to see improvement in. But then also maybe one patient is not enough to see really. Maybe
Yeah, exactly,
5 to 10
yeah.
patients to make sure. But in actually next month we may have 2 more patients with the neck surgery.
Oh,
So-
nice. Yeah.
So after 3 months, we may have 4 or 5 patients. So we will.
And at which level?
Well, all of those patients they are above C5 level.
Like me, C5, C or less.
Yeah.
The same
Because
level.
if patient has C6, C7 level and has good function, then we always go for the epidural stimulation.
Okay.
If the patients they have good hand function, then epidural stimulation is the first option.
Okay.
So it should be any patient who is getting the local spinal cord injection, it should be a quadriplegic.
But of course, when you inject stem cell therapy in the down back, it's more easy to recovery because, like you said before, it can walk a little bit and you have more function.
Yeah, and it's the spinal cord at lower level is simpler as compared to the spinal cord above level. It's easy to regenerate but it's difficult to regenerate in the neck.
Yeah. Okay. But you think it's possible to see how he walk after?
This patient?
Yeah.
Yeah, sure, you can.
Just to see how he walk in the swimming pool or in the bar.
These days he's getting a program only for his ankle, so he's not going to. We are not going to do any hoist training
Okay.
because his ankle, we are just working on his ankle.
Okay. But when I can see that, you see?
I would say next week maybe, but he's here only until Tuesday, so he came only for 4 days just for one simple program.
Yeah.
Because most of his programs are working, but his ankle is not here yet.
So you need to work with the maps, or you don't know?
Yeah, so we have the therapist is working with the device and trying to get the movement in the ankle.
The ankle to put like that, yeah.
Yeah.
Because
so-
after you walk without absolutely no
No, he's
Atel.
No, he's when he walks, he drags his legs. He
Yeah.
drags, but he cannot do the proper ankle movement. So now, his quads are working very good, but his ankle is always drop. So we
Okay.
are working to control his ankle now.
Okay, okay.
Yeah.
So can I